big a problem is heart disease in women?
Put simply, it's the biggest killer of women globally. I think the bigger issue is that women don't realise this. So not all, but a lot of heart disease is preventable. But women are focused on their reproductive health, on having babies. We're good at screening for breast cancer, pap smears, skin checks, all of that. But heart disease isn't on our radar.
You set up a heart clinic at the Alfred Hospital, which is dedicated to women. Why did you see the need for that?
Because we were starting to see in the literature that women were presenting differently, women were having worse outcomes, women weren't getting the same treatment that men were getting, women were responding differently to treatment. So we realised at a scientific level that things were very different and we needed to look into this.
Can you explain then the difference between men's and women's heart disease and how they present differently?
So the most common cause of a heart attack is a blockage in the artery that supplies the heart muscle, and that's the same for men and women. The classic symptom is chest pain, and that's what we see in the movies. But the thing is that women can often have associated symptoms, so they might get a bit of chest discomfort, but they might have nausea or dizziness or breathlessness that sort of distract them from the fact that they've got the pain. Or they may have no chest pain. They might get discomfort in the shoulder or just heavy arms or in the jaw, so they're not aware that they're having a heart attack or they're having heart symptoms. And that's a problem because they will delay seeking help. And even when they do seek help, they may not be thought to be having a heart attack, so therefore they're not investigated in a timely fashion. And in heart disease, time is really critical. So you can see how things happen in a way that perhaps is not the best for the patient and outcomes can be worse.
Is there an element too around women being educated to understand what their body is telling them and what the symptoms might mean?
Look, it's tricky. We've seen some nasty data about the fact that women are more likely to be diagnosed with anxiety when they present with a heart attack. You know, there's a lot of concern and women are often afraid to present because they don't want to be annoying anybody, they don't want to be causing trouble, and perhaps they don't present when they should and they're fearful of being told, you're just a bit anxious, it's okay, go home.
Because we so often hear that we should be advocates for our own health, but how often are we presenting and then perhaps being sort of sent on our way? That gets a bit tiring.
Absolutely. And I think we're learning now too that we can find signs of increased risk earlier on in a woman's life. So for instance, pregnancy is a really big stress test for the heart. So if you have complications during your pregnancy, something like preeclampsia or hypertension, so that's high blood pressure, or gestational diabetes, small baby or early delivery, you're more likely to have heart disease. So we know that if we intervene with these women earlier, even if it's just lifestyle and education and saying, okay, you're at higher risk, 1, this is what you can do to minimise your risk, and 2, these are the symptoms that you've got to look out for, you can make a really big difference.
What other risks should we look out for as women?
So in addition to the pregnancy issues, there's things like menopause. So that endogenous oestrogen, which is the oestrogen our bodies make, is really protective. And the moment that starts to fall away, risk of heart disease starts to go up. We see changes in cholesterol, changes in the way the vessels function. So menopause is actually a time when a woman should really go and see about having their heart health checked if they haven't before. Now, if you have an early menopause, so 45, 40, or goodness, even 35, your risk is much higher. So it's important for women to also realise that menopause is a really big issue. The other thing to say is that the traditional risk factors that we all know about, such as smoking, diabetes, high blood pressure, have a slightly different strength or weighting in women. So smoking is a much bigger risk factor for women than it is for men. So it's the same as diabetes. Inflammatory disease is another thing. So something like lupus or rheumatoid arthritis really increases one's risk of heart disease. So they're just little things that if we get the knowledge out there, people can sort of go, okay, I've got a few risk factors. I need to go and see what I can do to minimise my risk. Women are at risk, and I really want them to be empowered to look after themselves. Seek help. A lot of this is preventable. Put yourself first.